Assalamualaikum and a very good morning to everyone. So, my name is Teacher Fikri and I'm going to present on seizures disorder and epilepsy and autism spectrum disorder. Let's go. So, at the end of this presentation, there are two agendas that I want to achieve, which is the first one would be introduction, exposure, and identify seizures disorder and epilepsies, followed by introduction to autism spectrum disorder, or in short form, ASD. So you might be wondering, what is actually seizures and what is actually epilepsy? And is there any distinctive differences between both of it? Of course there is. So seizures are inconsistent, where it is temporary changes of motor activity. But when it comes to epilepsy, it is a chronic neurological condition that occurs with or without brain abnormalities, which means that even even you don't have brain damage, that you can suffer from epilepsy regardless of children, adult, or elderly. So, do you know that there are two major types of seizures, which are generalized seizures and partial seizures? So, generalized seizures happens at cerebral cortex in the brain, while partial seizures begin from a single location and then towards limited space or spread towards to become generalized, which means that it can happen at one single places, let's say in a muscle, but then it can spread towards in the hand, the overall muscles in the hand or overall body to become like generalized seizures, which is overall. And then types of generalized seizures, there are four, which are tonic, absence, myoclonic, and akinetic. And I know you might be wondering, oh my God, there is so many terms that I want to remember. Can you help me on how to understand this deeper? Don't worry, I'm here to explain it. As you can see, there are four types of generalized seizures, which are tonic, absence, myoclonic, and akinetic. So let's start with tonic first, shall we? So tonic seizures occur more frequently in comparison to other three, which are absence, myoclonic, and akinetic, where it involves in excessive neuron firing that may appear as lost consciousness, or we could say pengsan, but they're not pengsan because there's a lot of neuron firing happening to the point that they have to collapse. Absence seizures are momentary loss of awareness where absence of motor activity happen except by blinking and rolling. So it can also be mistaken as daydreaming, which is very important for parents or dear friends to analyze first whether or not this person or a child is daydreaming or having absence seizures. Myoclonic is a contraction of single muscle or small group of muscle, which means it can happen maybe parts of the body. And for example, contraction of single muscle where kita cramp, kita akan guna term cramp, but it's almost similar towards that one, which is myoclonic seizures. And akinetic, we can understand kinetic is movement. Akinetic is not a movement because of a loss of a muscle tone could be the primary problem that happens due to that. So next will be, I know you might be wondering, okay, but what about partial seizures? Okay, there are two types of partial seizures, which are complex partial and simple partial. So complex partial may show automatic response such as lip smacking, chewing, while simple partial can be happens having psychic symptoms include visual hallucination, illusion, or auditory hallucination. Can also appear as nightmare awakening, which is why partial seizures are not like general seizures. We can see that it happens lesser compared to generalized seizures, which happen throughout the body. It can appear partial. So next would be autism spectrum disorder, or ASD, or pervasive developmental disorder, is where it is the symptom, but we use ASD most because it's the most documented when it comes to terminology. And it can be characterized as a severe and complex impairment towards reciprocal social interaction and communication skill. In easy way to say, komunikasi dua hala being impacted the most. So when it comes to communicating with people who diagnosed with ASD, it's a bit difficult for them to reciprocate that as because of the impairment, the complex impairment. And early research shows that 3 out of 1,000 people diagnosed with ASD, but later on in the recent year, there are increase in number, which is 6 out of 1,000 people, which is a lot. And currently, ASD is categorized under neurobiological disorder in accordance to DSM-5 because we, research shows that there happens to be about the wiring in the brain and how does it highly impacted on a person, which is why it is categorized under neurobiological disorder. So today I want to touch on autism and also Asperger's syndrome. So autism is where it coexists with other neuropsychiatric disorders such as seizures, ADHD, and OCD, because we can see there's a repetitive and ritual behavior where they want to, there's a rigidity, and also four subclasses to identify autism include disturbance in social interaction, communication behavior, and sensory processing impairment. And Asperger's syndrome is also part of ASD, but I understand how it can be sometimes quite difficult to see the differences between autism and Asperger's syndrome, where this is also another form of ASD, but to make it different is that rigidity and repetitive behavior and thinking pattern is more visible in as Asperger's syndrome, more in comparison to autism people. So, and that's all from me. Thank you very much for giving some time to listen to this presentation. And yes, I wish you all the best. Thank you.